prevention, preparedness and response, according to the principles of solidarity and equity. We believe that the text drafted so far, however, lacks the ambition that Peru was looking for when it engaged in this process. Therefore, it doesn't yet satisfy our expectations. However, we are aware that the process has not reached an end at this assembly. We must continue to work to try to find concrete agreements to help us to consolidate our national capacities and strengthen international collaboration through a mechanism for timely and equitable access to health tools, the implementation of a One Health approach, transfer of technology, and a system of access and sharing of benefits through the exchange of pathogens. All of this should help us to protect the health of our people. We are pleased that progress has also been made in the negotiation for specific amendments to the IHR, which we believe will improve national processes and capacities to prevent and respond to public health emergencies. President, we in Peru cannot forget the devastating consequences and loss of life generated by the pandemic because of inequitable access to health tools. We continue to face global challenges, including emerging health threats and climate change. Over the past 2 years, Peru has also faced dengue outbreaks, the impact of which was worsened because of an increase in temperatures and rainfall exacerbated by climate change. In that view, looking at that nexus of climate change and human health through an approach for prevention and preparation is absolutely vital for our country. So at this assembly, along with the Netherlands and a group of countries, Peru has submitted a resolution on this nexus between climate change and health. And that resolution is designed to strengthen the links between those discussions at multilateral level, strengthen national health systems to make them more resilient to climate change, and ensure that health systems are more and more sustainable. And we hope to have the support of your delegations in this process, and we encourage the Director General to continue to draw attention to this issue, the need to deal with climate change in a cross-cutting manner. Thank you.
Thank you. Cyprus, you have the floor, to be followed by Norway.
Mr. Chair, Director General, Excellencies, ladies and gentlemen, Cyprus aligns itself with the EU statement. The health situation worldwide presents a multifaceted challenge exacerbated by the emerging diseases, persistent inequities, and the impacts of climate change. At the same time, a new global health crisis has further emerged due to the ongoing military conflicts that have devastating and disastrous impacts on people globally. Undoubtedly, the COVID-19 pandemic has profoundly highlighted the vulnerabilities in our global health systems. It has shown us that health crises can rapidly transcend borders, demanding a coordinated international response. While we continue navigating these complex health landscapes, the successful outcome of the ongoing negotiations of the international negotiating body and international health regulation is crucial on managing future pandemics and mitigating their impact. It is imperative that we address collectively these global challenges, leveraging our shared knowledge and resources to build a healthier future for all. This year's Assembly theme, All for Health, Health for All, should serve as a navigation point while sailing through turbulent waters. Cyprus provides a pertinent example of navigating these global health challenges while making notable strides in improving public health. To this end, in 2019, Cyprus launched its general health system offering health cover to all our people based on principles of universal cover, financial solidarity, equal access and provision of high-quality healthcare services pursuant to the third Sustainable Development Goal of the 2030 UN Agenda. We created a robust healthcare delivery network with the participation of more than 90% of the country's healthcare workers. This resulted in a dramatic decrease in private healthcare expenditure, dropping from around 50% to around 12%. While feeling proud of these significant achievements, we acknowledge that the 5-year-old health system has its weaknesses and inefficiencies and understand that we must address this to ensure the general health system's long-term sustainability. We are sure that the provision of universal health cover in Cyprus will have a beneficial effect on the health of our people and that in turn it will transform into growth and development. Excellencies, as we live in an interconnected world where health transcends geographical boundaries, socioeconomic status and cultural differences, we recognize that we are as strong as the weakest link in a chain. Thus, I call all to invest in health. Let us make universal health cover really universal. Concluding, let me express my sincerest gratitude personally to you, Director General, and to all your staff for the extraordinary work on the ground in ensuring the highest attainable standard for health for all. Thank you.
Thank you. Norway, you have the floor, to be followed by Saudi Arabia.
President, Director General, Excellencies, colleagues. First, let me do as my colleague, thank the Director General and the WHO staff for all your efforts to promote, provide and protect health for all. Colleagues, the world's eyes are upon this health assembly. It's our joint responsibility to find common and more equitable solutions to the shared risk of devastating pandemics. Significant progress has been made. Important commitments are within reach, but there are still substantive differences that need to be overcome. We must agree on an orderly process towards a successful finalization of the pandemic agreement and the targeted amendments of the international health regulations. This Assembly will also adopt a new general programme of work that clearly puts WHO at the centre of global health architecture. A strong and effective WHO requires trust, accountability, transparency and sustainable financing. As an incoming board member, we will work to this end. Norway also remains strongly committed to the success of the investment round and to finalise the increase of the assessed contributions. WHO's work is increasingly challenged by external threats such as climate change, antimicrobial resistance and a growing number of crises and emergencies. Norway acknowledges the important role WHO plays responding to health needs in complex and challenging humanitarian crises. The war in Gaza has led to tremendous destructions, sufferings and death. We have been witnessing a rapidly collapsing health system, attack on health facilities and medical personnel. We have repeatedly called for a ceasefire and for the parties to comply with the international humanitarian law, protecting civilian, humanitarian personnel, health workers and health facilities. We underline the extreme urgency of providing safe space and adequate medical supplies and health care. Russia's invasion of Ukraine continues with grave consequences for the health of Ukrainian citizens and civilian infrastructures, including health facilities. Norway condemns Russia's aggression against Ukraine in the strongest terms. Dear colleagues, the right to health cannot be achieved without universal health coverage, underpinning by accessibility, robust and sustainably financed health system, with a focus on primary health care. Ensuring access to preventative and integrated services, including sexual and reproductive health and rights, is essential. Investing in health is investing in our women, our children, our society and our common future. Making this investment is our responsibility as leaders. Only then we can achieve all for health and health for all. Thank you.
Thank you, Saudi Arabia, to be followed by Colombia.
رئيس أصحاب المعالي والسعادة.
May the peace of God be with you. Thank you for this opportunity. We recently celebrated the 75th anniversary of this organization. We reiterated our commitment to ensure health for all. But in spite of that commitment, we see that our world today is fighting so many crises and emergencies. And in order to deal with them, we need fresh optimism and collective efforts. I encourage everybody to commit once again to doing that. But in spite of all of the efforts that have been made, we see that there are a number of countries that continue to face the challenge of inequalities and the consequences of the COVID-19 pandemic. That's why Saudi Arabia has given its commitment to work together with all to try to agree on a treaty to better be in a position to prevent and prepare and respond to future pandemics. We need more than ever strengthened international cooperation to enable us to deal with future health challenges and achieve health for all. Ladies and gentlemen, in Saudi Arabia, thanks to our strong leadership, we work tirelessly to strengthen our health system, focusing on pillars such as strengthening the response to health emergencies, improving mother and child health, and other priorities. And once again, we'd like to reiterate our determination to combat antimicrobial resistance. We have called for the hosting of the 4th Ministerial Conference on antimicrobial resistance at the end of this year. We know that health can only be strengthened if we work together, and that's why we've called for multidisciplinary action in all areas. President, ladies and gentlemen, the health crisis continues in Gaza. Every day we hear of fresh disasters, that there are thousands of victims, most of them women, the elderly and children, and the healthcare system just cannot cope. That's why we call upon Israel to respect international humanitarian law and to allow healthcare for the civilian population. And we call on the international community to ensure respect for the two-state solution, which is the only possible one in this area, and that should be implemented in accordance with international law. Finally, the Palestinian people need to enjoy respect for international law. Thank you for your attention.
Thank you, Colombia. You have the floor, to be followed by Georgia.
President, Director General, distinguished delegates at the World Health Assembly, Colombia extends greetings to delegates. Once again, this World Health Assembly is looking at key health issues to guarantee the fundamental right to health and the protection of life at universal level without discrimination. Strengthening the global commitment to put an end to armed conflict and to consolidate peace. We believe that immediately we must put a stop to the genocide of the Palestinian people. We must respect healthcare. We must allow humanitarian assistance and guarantee justice and recognition of the Palestinian state. Colombia puts life before everything, and we, under our president, have been carrying out significant reforms to improve our healthcare system to achieve UHC based on primary healthcare, preventive approaches, intercultural work with dignified work for the health workers, integrated networks, and health sovereignty. And we thank the Director General for having sent a support mission for primary healthcare as a key component of our reform of the healthcare system in Colombia. We are working forward with immediate and executive measures to ensure greater equality and to have a better impact on social determinants of health as well, ensuring that education is a key right and extending access to higher education to all. We want to ensure that everybody benefits from national health insurance, irrespective of the contributions that make. We need to ensure that our indigenous peoples, our persons of African descent, our remote communities have access to land and prosperity. We need to have a more productive economy based on work, knowledge, alternative energies to ensure climate change adaptation and mitigation, and to achieve peace as a consequence and a condition for social justice, for dignity and health in our country. Over the past few years, we've made great progress in extending primary health care through thousands of medical teams, and we have undertaken the recovery and modernization of our basic healthcare system throughout the country. Direct financing, the implementation of shock plans for dealing with child mortality, to deal with different kinds of cancers and other NCDs. For the first time in Vienna, through the leadership of Colombia and other countries, we are trying to combat the scourge of drugs together with other countries around the world. And I'd like to thank WHO for their support in this regard as well. Thank you.
Thank you, Georgia, to be followed by Guatemala.
Honorable Director General, distinguished delegates, it is my privilege to address you on behalf of the Ministry of IDPs from the Occupied Territories, Labor, Health and Social Affairs of Georgia. We welcome the consolidated report presented by the Director General and would like to reaffirm our continuous commitment to achieving universal coverage with quality health services for all. Health as a precondition for sustainable societal and economic development of the country remains the government's top political priority. Since the inception of the Universal Health Care Programme in 2013, substantial success has been achieved in ensuring population coverage with state-funded health benefits. Over the past 2 years, reforms implemented by the government in the pharmaceutical sector, including price regulation and managed entry agreement mechanisms, enabled us to fully eliminate financial barriers to chronic disease management and cancer drugs. Given the significant burden of non-communicable diseases, recent governmental strategies focus on tobacco control, promoting physical activity, and encouraging healthy lifestyles. Challenges experienced during COVID pandemic have triggered integrated efforts towards health system strengthening and health security. National stakeholders and global partners have made increasing investments in building capacity of emergency medical services and state-owned hospitals, upgrading public health laboratories and primary health care units. Georgia has increasingly been integrating environmental health into public health strategies. Work is underway on strengthening chemical biomonitoring. We recognize that success of the UHC program depends on skilled and motivated healthcare workers. Earlier this year, the Parliament endorsed a new legislation on nurses and midwives, promoting a key role of these professions for better addressing patients' needs. Technical assistance provided by WHO and other international partners has been one of the key success factors throughout the universal healthcare reform. Addressing antimicrobial resistance, elimination of viral hepatitis, and pandemic preparedness are key areas for this collaboration. Georgia remains committed to creating inclusive, sustainable, and resilient health system that contributes to a society in which every individual can achieve their highest potential for health and well-being. I thank you for your attention.
Thank you. Guatemala, you have the floor to be followed by Sri Lanka.
Excelentísimo Director.
Distinguished Director General, distinguished delegates, on on behalf of our President, Bernardo Adhanom, I would like to thank you for the invitation to attend this World Health Assembly. This is the highest international forum for discussing the major progress that our countries have made towards UHC. And humanity is facing numerous challenges on health and quality of life. This type of forum, dealing with issues such as all for health, health for all, are a reflection of our increased international commitment to achieving universal health coverage, taking into account prevention and early detection of risks. We need to work together to improve our capacities for pandemic prevention, preparedness, and response. We have a GDP of $77 million, and we are the largest country in Central America. However, we are the country with the highest level of poverty among children and the highest rate for issues of health problems affecting these children. And that's why we are trying to improve the technology that we use in order to reduce the disease burden throughout our national territory. We recognize the importance of social participation in health. It's a multi-sectoral challenge, and we need to overcome this gap of quality between the public sector and private sector. We need to deal with issues such as traffic accidents and NCDs. We need to have a health framework to improve the chronic conditions and critical conditions that people face, involving municipalities and all of the agencies that make up our state. This has a great potential to change the risk profile for the areas most affected. Over the past 10 years, the number of chronic renal disease has increased in the country. And so chronic renal disease is now one of the major causes of morbidity in the region. We need to deal with NCDs more effectively. They must be a priority. We also believe that we need to include transplants and donations in our strategies for dealing with NCDs. Our country is one of the most vulnerable countries to climate change. In 2021, more than 600,000 cases of COVID-19. Many of them were mortal. We have tropical storms that have caused tremendous damage to our healthcare system. And there were a number of deaths related to those events. We welcome the efforts that our country is making to try to improve the health of our population. And we thank Taiwan for their support in cooperation in the technical and financial fields. Thank you.
Thank you. Sri Lanka, you have the floor, to be followed by Ireland.
Honorable President, distinguished Director General, Excellencies, ladies and gentlemen, I am delighted to state that the government of Sri Lanka truly appreciate and thank the Director General and the Secretariat for steering global health to calmer waters from the pandemic. It was an extraordinary work done by the World Health Organization. We truly admire it. We look forward to the international health regulation reforms and strengthening pandemic preparedness and response. Mr. President, to advance towards sustainable development goals and the universal health coverage, it is important to regain the momentum for strengthening primary health care and broaden the horizons of range and scope of services to deliver comprehensive care. Mr. President, Sri Lanka must focus on NCD management and addressing the other health issues through primary health care strengthening, which includes strengthening health promotion, rehabilitation, mental health, and integration of community services, aiming at disability reduction and healthy aging. In Sri Lanka, past investments in free education, free health, and strong public health facilities have proven excellent health outcome for low-cost intervention. To ensure sustainability and effectiveness, we need to further invest on human resources for health, building capacities, and focus on occupational health to maximize the human resource productivity. Mr. President, Financial capacity of individuals has multidimensional effects on health, ranging from access to information, health-seeking behavior, and accessibility, which need further discussion at multi-sectoral global health platforms. This highlights the needs to build resilient communities and resilient health systems with adequate capacities to respond to the current needs. We strongly believe new global health challenges will need more concerted efforts, proactive and collaborated actions, and building strong partnerships. Ladies and gentlemen, knowing the importance of One Health approach, striving towards improved data and innovation, research in all sectors, we acknowledge the critical need of good governance and strong political commitment for health. Mr. President, I am standing here to reaffirm our commitment towards all for health and health for all. I thank you.
Thank you. Ireland, you have the floor, to be followed by Thailand.
Mr. President, distinguished delegates, Ireland aligns with the statement delivered by the European Union. I'm happy to reiterate Ireland's continued support for the WHO's essential work and for its central role in global health architecture. Ireland welcomes the launch of the WHO investment round. The WHO needs to have security and flexibility of funding to ensure it can plan and respond effectively to global health issues. It is for this reason that Ireland will increase its contribution to the 2028-2029 levels, and we will do so from this year. Ireland is expanding services in physical and mental health. In youth mental health, we are deeply concerned about the profound harm being caused to so many young people by social media platforms, including Twitter, TikTok and Snapchat. The EU's Digital Service Act is just one tool that must be fully enforced, changing how these companies behave. Tobacco consumption continues to challenge our health services. My government has decided to increase the minimum legal age of sale of tobacco from 18 to 21 years of age. We're expanding women's health services. This includes specialist services in menopause, endometriosis, fertility and mental health, as well as providing free contraception to all women. Universal health coverage means affordable, accessible and inclusive, including sexual and reproductive health as set out in the Sustainable Development Goals. Protecting the right to health for girls, women and mothers is a precursor to gender equality, sustainable growth and development. Ireland's international development policy prioritises gender and equality. It emphasises too the importance of the protection of healthcare facilities and healthcare workers in humanitarian settings. We are deeply concerned, Mr. President, at the sustained and the deliberate attacks on healthcare workers and health facilities in Ukraine and Gaza, and we strongly condemn these attacks. Finally, I'd like to acknowledge the World Health Organization's contribution to health in emergencies. Ireland applauds WHO staff who have been at the forefront of international humanitarian responses in the past and around the world today. And to all of those frontline healthcare workers, Ireland says, we see you, we recognise your work, we value your work, and we thank you. Thank you, Mr. President.
Thank you. Thailand, you have the floor, to be followed by China.
Mr. President, Mr. Director General, Excellencies, distinguished delegates. As was the case with other countries around the world, the recent global pandemic severely tested Thailand's public health system. But through our collective resolve and determination, we emerge even more robust and united in our mission to safeguard the health and well-being of our people. This moment calls for us to reflect on the critical issues facing WHO member states, especially our collective responsibility to ensure equitable health care and quality health for all. The concept of health for all is indeed a cornerstone of Thailand's public health identity. It is personified by Thailand's unwavering commitment to universal health coverage. We are humbled and proud that our nation has earned international acclaim for delivering comprehensive healthcare services without any financial burdens to our citizens. This highlights our fervent belief that health is a fundamental human right, deeply embedded in our nation's conscience. In today's world, public health is an integral part of the global agenda. As current chair of the Foreign Policy and Global Health Group, Thailand has worked to leverage the intersection of diplomacy and public health to advance global health equity. Fully mindful of our interconnected world, we have championed initiatives that emphasize the intrinsic links between diplomacy, development, and health, with a view to fostering a more inclusive and equitable global health landscape for all. Mr. President, distinguished delegates, we currently stand at a juncture where significant progress in public health has been made, and we must be grateful for this. Nevertheless, we remain aware of the formidable challenges that lie ahead. The need for collaboration, both within our borders and across international boundaries, is now more urgent and necessary than ever. We must therefore redouble our efforts to bridge existing gaps and ensure that the benefits of our progress are truly shared by all. Let us therefore join hands even more firmly from this day onwards to realize the ultimate goal of health for all. Guided by the spirit of solidarity, let us forge ahead together with renewed vigor towards a future where health equity is not just an aspiration, but a reality for everyone. I thank you, Mr. President.
Thank you, Chair. Now you have the floor to be followed by Brunei Darussalam.
Honourable Chair of the Assembly, Health Minister Edwin Dikolotti of Botswana, Honourable Director General Dr. Tedros, ladies and gentlemen, first, please allow me to congratulate the Chair of the General Assembly on his election. China has always put the people first and continues to promote the Health China initiative. We have achieved a remarkable progress in this regard. First, the average life expectancy of the Chinese people increased from 74.8 years in 2010 to 78.2 in 2021. In 2023, the maternal mortality rate was 15.1 per 100,000. The mortality rate of infants and children under 5 were 4.5 per 1,000 and 6.2 per 1,000 respectively. China's key indicators of maternal and child health rank top among middle and high-income countries. The Chinese government has continued to increase financial input to lower gradually the medical expenses of patients. We have improved the national medicine purchasing policy. The proportion of personal health expenditure in total health expenditures dropped by 7% from 2012-2022. The capacity of a healthcare system has been continuously enhanced, focusing on tiered diagnosis and treatment. We've channeled quality medical resources to the grassroots level, facilitated the formation of community-level health professionals, focusing on GPs. The capacity of health services has been improved. China has built the world's largest healthcare system. In 90% of cities and rural areas, people just need 15 minutes to reach nearest medical facility. Ladies and gentlemen, health is an important part of the 2030 Agenda for Sustainable Development. At present, progress in implementing the agenda has fallen far short of expectations. Countries must therefore join hands to promote quality health development. All for health is the prerequisite of health for all. China has long been committed to to promoting global health. Over the past 60 years, China has sent 30,000 medical aid workers to 76 countries and regions in Asia, Africa, Latin America, Europe, and Oceania, built more than 130 medical and health facilities, and treated nearly 300 million patients. A tangible Chinese contribution to promoting equity and access to global health. China will continue to support the WHO in playing a leading role in coordinating necessary and sensible reforms of the global health governance system, which are expected to effectively increase the representation and voice of developing countries. China is ready to strengthen cooperation with the international community, implement the 3 major initiatives on global development, security, and civilization, and promote the building of a community of shared human health. Just now, certain countries have mentioned in their statements the so-called invitation to Taiwan as an observer of WHO. The Assembly has already ruled on this, which has fully demonstrated one China principle is unquestioned, unchallenged, and supported by the international community. Any attempt to engage in political maneuvering with Taiwan is doomed to fail and is counter the one China principle.
Islam, you have the floor, to be followed by Cambodia.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. And a very good morning. Mr. President, Director General, ladies and gentlemen. This year's theme, All for Health and Health for All, is an opportunity to review and identify ways to strengthen global action to reach this ambition. The discussion on the 14th General Program of Work at this Assembly should strengthen our shared commitment. As we consider the GPW, allow me to share 3 reflections. First, health for all begins at home. As member states, we bear primary responsibility for the health and well-being of our people. To this end, in Brunei Darussalam this year, we are investing an additional 37% increase in healthcare expenditure compared to the last year. Alongside this increased investment, we are revising our national 5-year strategic plan to future-proof our healthcare system going forward. To ensure healthcare sustainability, our strategic plan will build on our successes in primary healthcare, particularly in our near universal health coverage, by shifting our focus from acute and episodic care to address care continuity, early disease detection, and patient empowerment. Digital tools, including our national medical health app, Brew Health, will allow new models of care and pilot innovative approaches to managing minor illnesses, freeing up clinician time and reorienting our systems from activity-based to value-based care. Our strategic plan will also leverage on advances in health sciences and evidence. The new Brunei Center for Disease Control and Prevention, established in October last year, will play an important role as a first step in our journey to better integrate health intelligence and data analytics to drive policy formulation and program delivery. We are not there yet, but we are building the road to get there. Second, Health for All reflects our shared responsibility as member states to each other. Over the last 2 years, negotiators from Brunei Darussalam have been working with others on a new pandemic agreement and amendments to the existing IHR. As a small country, strengthening the global health security architecture is vital to our national interests and our first line of defense in facing future public health emergencies. The next pandemic will not respect any human timetable, and the world needs this pandemic agreement without delay. But the world also needs the right kind of agreement. There is little point in our efforts merely preserve the status quo and does not result in material change to communities. We have and will continue to be flexible. Finally, to this end, if health for all is to have any significance, we should mean health even to those in humanitarian emergencies. We regret the ongoing situation in Gaza and the occupied Palestinian territories, resulting in the death and injury of thousands, including healthcare workers and more than 100 UN and WHO staff. We note the resolution adopted by the WHO Executive Board, and we highlight our concern at the deteriorating situation in hospitals and other healthcare facilities. In context, health for all must mean the immediate, sustained, and unimpeded passage of humanitarian relief in Gaza Strip. We urge all parties to fulfill the obligation.
Please conclude the statement.
Thank you.
Thank you, Cambodia, to be followed by Portugal.
Monsieur le Président,
Mr. President, Director General, dear colleagues, I am honoured to participate in the World Health Assembly to share the voice of my compatriots, health professionals and patients. On their behalf, first of all, I would like to thank the WHO, which helped us to achieve the Health Millennium Development Goals and which continues to help us. Our country is facing a multitude of cross-cutting health challenges, which requires a strong increase in resources at a time when instability and conflicts across the world make access to resources more difficult. Therefore, faced with the scale of the collective task which remains to be accomplished, I stand before you to advocate for strengthened international collaboration, which is inclusive, unified and effective. In fact, while most challenges are global, the capacities to confront them are not always equally distributed. We do not yet have sufficient health human resources, we cannot access therapeutic innovation, and we cannot offer every chance of recovery to patients suffering from serious diseases. And although it is our responsibility as leaders, saving lives waits for no one. Innovation is one of the keys to success, but it loses all meaning if it is not accessible for all. Our world must not be globalized only when it comes to trade, it must also be globalized for sharing data and knowledge, resources and therapeutics, as the COVID-19 pandemic reminded us. I have mentioned aspects for which we are dependent on external constraints. As for our national conditions, we are doing our share of the work. But we need international collaboration to strengthen both our security and our autonomy, because given these global challenges, the global health architecture remains fragmented and much remains to be done to achieve equity. We would like to participate in great international debates on an equal footing, to present our ideas and to join shared efforts designed to build a more equitable world in the face of health risks, because without equity, there will not be effectiveness. This goal cannot be achieved without modifying global economic relations which govern the global health ecosystem, and in particular this requires strengthening and broadening the notion of health as a global public good, in particular for vaccines in epidemic emergencies. In order to re-establish equal opportunities for all when combating disease, we need a stronger global regulatory framework which recognizes the obligation of solidarity and equity and which defines the responsibilities of each and every one and ensures that commitments be upheld. Thank you for your attention.
Thank you. Portugal, we have the floor, to be followed by Mongolia.
President of the World Health Assembly, Director General, distinguished colleagues, ladies and gentlemen. I'm honored to address this Assembly on behalf of Portugal. We align with the previous statement by the European Union. We gather under the theme All for Health, Health for All, highlight our commitment to universal well-being. We note with concern the rise in global health emergencies, including man-made health emergencies and humanitarian needs. We call for an end to all conflicts, including an immediate stop to those in Ukraine and Gaza, and the immediate release of all hostages. The impact of clinical change on health has well been worsening, as seen in recent floods in Brazil and other parts of the world, and must be prioritized. Portugal fully supports the WHO 14th General Programme of Work, a crucial step for global health. GPW 14 strategic vision to promote and protect health worldwide align with our national priorities and reflect a progressive approach essential for today and tomorrow global health challenge. We applaud the efforts to promote a sustainably financing organization through the launch of the first investment round. Portugal reaffirmed its commitment to pandemic prevention. Preparedness and response are aligned with the innovation approach proposed by the Director General, such as the Universal Health and Preparedness Review, of which we are a pilot country. The WHO Academy will also play an important role in promoting global technical capacity, ensuring that all countries are better prepared for and capable for responding to future pandemics effectively and equitably is a moral imperative. Portugal stands ready to contribute constructively to this effort, prioritizing global solidarity and cooperation. We must future-proof our health system for the generation to come. The decisions and actions we take in the present will define the health and well-being of millions of people worldwide. Let us move forward with conviction that we can achieve health for all. Thank you.
Thank you, Mongolia, to be followed by Cuba.
Mr. President, Director General, distinguished delegates, ladies and gentlemen, it's my great honor and privilege to address this very distinguished audience on behalf of the government of Mongolia. It's the 77th World Health Assembly. This assembly holds great significance for several reasons. We have gathered here within the shared objective of promoting health and well-being for all. Our collective aim is to ensure that all individuals, in particular vulnerable population, are afforded better protection and can obtain optimal health and safety. Yes, we stand together in our mission to enhance and safeguard the health and well-being of all people. Mr. President, global health security is now more critical than ever as the world confronts the threat of emerging and re-emerging infectious diseases as well as natural and man-made disasters. This includes reinforcing integrated primary health care service delivery and addressing the needs for public health service. Moving forward a healthier and safer world, my government remains fully committed to continuously improve health outcomes and meeting the health and well-being of our current future generation. Mr. President, the World Health Organization rightfully holds the position of the leading global health agency. Over the past 75 years, it has demonstrated its authority by adopting and endorsing important normative instruments that protect global health. Most recently, it has spearheaded the largest response in human history to the global pandemic. This has prompted the organization to undertake the crucial and urgent task of ensuring that countries are better positioned to prevent the spread of cross-national infectious diseases or health emergencies that could escalate to pandemic, climate, lives, and health. The world needs a stronger WHO, one that fulfills its promise of the health for all. Whether WHO can deliver on its promise or not depends on our collective political will and commitment. We need a strengthened WHO. This can be achieved by renewing our commitment to health and well-being, supporting the final result of the extensive dialogues we have had over the past 2 years regarding the amendment to the international health regulations and newly drafted pandemic accord. We must utilize this lesson from the COVID-19 pandemic as a catalyst for improving and seizing the moment to renew our commitment so that our future generations are better prepared and protected. In conclusion, Mongolia urges the member state to seize a decisive moment for the important agenda set in this Assembly's work, ensuring that we have a stronger WHO that can deliver meaningful results and play a truly legitimate leading role in global health and security through committed funding and improved coordination mechanism. I thank you.
Thank you. Cuba, you have the floor to be followed by Madagascar.
Thank you, President, Your Excellencies. We are faced by a great many challenges, and that's why All for Health, Health for All is a call for action, for greater unity and greater hope to our peoples. In an increasingly interconnected world, the WHO's agenda for 2030 and the One Health approach show that we need to work together in order to deal with all of these global health challenges. We need to achieve genuine collaboration between international organizations and governments to enable us to deal with current challenges in a sustainable way, find financial mechanisms and scientific cooperation that works. We need to evolve, we need to ensure that we deal with these repeated crises, and to do so, Cuba has participated in the relevant negotiations for a WHO agreement or other international instrument on pandemic prevention, preparedness and response. Your Excellencies, the national health system in Cuba is integrated, comprehensive and intersectoral. It's a key pillar of our state's social policy, guaranteeing free healthcare to all of our people. Through solid primary healthcare and community health structures, we are in a better position to improve health indicators for our people and share knowledge and experience with others around the world. It's good practice that we continue to encourage through the principles of solidarity and generosity. For more than 60 years, we have been pursuing this approach and providing support to more than 150 different countries in order to try to help them learn from this approach. We don't understand the approach of the United States government, which has been pursuing this economic and financial blockade on my country, preventing us from improving our national health system further. We condemn the health situation in Gaza. There is no excuse for destroying healthcare infrastructure and attacking humanitarian workers and health workers who are just there to try to protect civilians who are innocent in this context. We need to invest more heavily in public health, and therefore we need firm commitments. Only with collaborative work can we build a better future, where health isn't a privilege, but a right accessible to all. Thank you.
Thank you. Scotia, to be followed by Madagascar.
President, Director General, distinguished delegates, ladies and gentlemen, the Czech Republic aligns itself with the statement delivered by Belgium on behalf of the European Union and its member states. In the recent years, we have all realized more than ever that unfortunately health cannot be taken for granted. The world is still far away from achieving the universal health coverage, hence it is of the utmost importance not to turn away from the principles of solidarity. Formulation of the Sustainable Development Goals represents our strong commitment to achieve better, higher quality life for all. As there are many urgent challenges we have to deal with, and as the global effort is undermined by several conflicts, we must do everything we can for health to ensure a better future for generations to come. This February marks 2 years since the onset of the unprovoked, unjustified and illegal Russian aggression against Ukraine. Its serious consequences for global health will be discussed by this Assembly. The Czech Republic strongly condemns this war of aggression and demands that the Russian Federation immediately stops its flagrant violation of the UN Charter, complies with its obligations under international humanitarian law and allows safe, rapid and unhindered access of international humanitarian and health organizations to the temporarily occupied territories of Ukraine. Ensuring such actions is crucial to making meaningful progress towards achieving health for all. We hope that the intense negotiations on the pandemic accord and amendments to the international health regulations will bring ratifiable outcomes that are respected and adhered to by all. This can only happen if a balanced approach is taken regarding their scope. The Czech Republic wishes to emphasize that the principle of equity must be respected and that health is a universal right. Therefore, the Czech Republic fully supports granting observer status to Taiwan at the World Health Assembly. No one can be left behind. We must not forget the patients, health and humanitarian workers, caregivers, and many others who work tirelessly to achieve the highest attainable standard of health. The globalized world is interlinked in each and every domain, and this is the reason why all sectors need to cooperate. Acting alone cannot be the desired game changer. The triple planetary crisis not only has a significant impact on the environment, but also poses a risk to humanity as a whole. There are many other examples of such interconnectedness that we could discuss, but what is more important is the common solution to these problems: extensive cross-sectoral cooperation. As a staunch supporter of multilateralism, the Czech Republic reaffirms its commitment to working with international partners, including the World Health Organization, to address health challenges and promote health equity. A strong political commitment at the highest possible level can bring us results consisting in the achievement of health for all. Thank you for attention.
Thank you, Madagascar, to be followed by the United States of America.
Monsieur le Président,
President, Director General, distinguished guests, this 77th World Health Assembly has the topic, A World for Health, Health for All. And this is an important theme for Madagascar because President of our country has made human capital one of the 3 pillars of its general policy. And this is why we have public health programs which enable us to ensure equitable access of our citizens to quality healthcare and to strengthen our healthcare system. And this strategy is implemented in our country. In line with WHO priorities, we are emphasizing prevention, in particular in family planning, and to eliminate avoidable diseases through vaccines, in particular polio, while focusing on children and reducing maternal and infant mortality, as well as on combating HIV. The increase in health facilities and the progressive modernization of equipment and public training aims to improve our healthcare provision, including for remote regions, and we have strategies of mobile equipment and open door policies in hospitals. We want to ensure the best healthcare possible for our population. Our partners participate in the implementation of such strategies, which has enabled us to provide quality health care for more than 1 million people in just 2023. The One Health approach, which is focused on multi-sectorality, will ensure that we have a greater achievements. And we are looking for effective inclusivity. In terms of universal health coverage, a number of strategies are being implemented in pilot areas in order to establish the best strategies for financing healthcare, to which we will all adhere. A lot remains to be done, and we must continue to invest in our healthcare systems in order to strengthen our partnerships and to work more towards equity in healthcare and to promote health. And this is really an honor, and it will enable every individual to live a healthy life, but also to have a world where everybody is a healthcare stakeholder at a global and national level. And in terms of the new instrument, the new pandemic agreement, Madagascar aligns with the African region with regard to equity, because equity is a crucial issue following the experiences of the COVID-19 pandemic. We must ensure South-South and North-South cooperation, and this experience is important to make this goal tangible. And we need to ensure this cooperation to ensure success for everybody involved. Thank you.
Thank you. United States of America, to be followed by Bolivia.
Esteemed colleagues, it wasn't even and it wasn't pretty, but the world emerged from the worst of the COVID-19 pandemic thanks to unprecedented collaboration that brought governments, the private sector, and the civil society together around a common goal: to save lives. But the further we get from the pandemic, the more memories fade. And as we forget, urgency dissipates. Unprecedented collaboration will be needed again if we are to prevent, detect, contain, and respond quickly to the many common threats that we face. We shouldn't wait for the worst case to descend. We should use our time here, now, after 2 years, to take the meaningful steps that we know we must. Let's capture the significant progress achieved over the past 2 years and finalize the proposed amendments to the IHR this week. Those amendments, especially the tiered alert system, will immediately make a difference in improving global preparedness. Finalizing the IHRs will build confidence in our ability to work together and set the stage for a more constructive future on pandemic response. And we can prove that the world is ready to respond in extraordinary ways to extraordinary events that threaten global health. Global health encompasses so much more than what a thermometer or a scale can measure. We must recognize the value of a world that is equitable and inclusive, the necessity of advancing sexual and reproductive health and rights for all, and the importance of including the voices of women, minorities, and LGBTQIA+ populations into decision-making. We also know that the health and security of each nation is irrevocably connected to the health and security of people everywhere. That is why we continue to strongly support the meaningful participation of Taiwan at the World Health Assembly and in the WHO's work more broadly. That is why we continue to say we cannot allow Russia's war in Ukraine to continue or the suffering and death to spread further, and why the international community, including the United States, will continue to stand with the people of Ukraine. And that is why the tragic, avoidable loss of life and cycle of destruction and dislocation between Israel and Palestine must stop immediately. We need a ceasefire agreement that leads to the release of hostages, a surge in humanitarian assistance into Gaza, and the road to a two-state solution. Palestinians and Israelis deserve to live safely, with dignity, and in peace. And that's why President Biden is fully committed to the WHO and the ongoing work of this body, including reforms that will make the WHO even stronger and a new general program of work that advances health equity. Health and threats against global health have an outsized influence on broader political and economic interests. There is no stability without health. There is no security without health. Our nations cannot be strong unless they are healthy. Esteemed colleagues, there is never
Please
a wrong
conclude the
moment
statement.
to strike a good deal for humanity and health, but moments are fleeting. Let us not forget the magnitude of this moment. Thank you.
Bolivia to be followed by Qatar.
Señor
President, distinguished Director General, delegates, I'd like to begin by bringing warm greetings from the President of the plurinational state of Bolivia, Luis Arce, to all delegates here at the Assembly. Under the theme, All for Health, Health for All, we're here to reiterate our commitment to work together to ensure the right to health and well-being for humanity as a whole. We are facing a multitude of crises in today's world, and unfortunately, some are taking steps that undermine international law. That must be stopped, and we must be redoubling our efforts to strengthen dialogue, cooperation, and multilateralism. The decisions we take at this Assembly should be guided by a commitment to health and life. We need to be aware of the tireless efforts of our peoples to fight the current inequities undermining global access to universal health, vaccines, and medicines. This should be considered part of the right to life. It's important to mention the progress made in the work of the INB for a better prevention, preparedness, and response to pandemics. And we mustn't lose this opportunity. We believe that we need to build on the progress that's been made and establish clear modalities based on transparency and inclusion. Intersectoral, interdisciplinary approaches are key in One Health. And that's also true for pandemic prevention, preparedness and response, and indeed for the amendment of the international health regulations. The overall objective must be to achieve greater equity according to the principles of solidarity, respect for rights, enabling us to be more effective in dealing with future health emergencies. Since 2019, our country has established health as a fundamental human right. And in the context of our healthcare system, we are trying to provide free, equitable healthcare to all people of our country, aware of intercultural issues as well. And that's why it's important that we believe we need to work to prevent disease and epidemics, reducing their burden. We need to strengthen our capacity to deal with these issues in our healthcare system. The potential for morbidity and mortality is much higher in the vulnerable populations, and this will help us to overcome the challenges posed through the recent pandemic. Under respect for sovereignty, we need to also exchange best practices and explore ways of strengthening capacities and enabling technology transfer, a key aspect for our countries. Finally, President, I must also reiterate to the Palestinian people our support and solidarity in the view of the terrible crimes and human rights abuses committed by Israel as an occupying power, and the international community mustn't allow this to happen with impunity. Thank you.
Qatar to be followed by Ecuador.
Mr. President, Director General of the WHO, Your Excellencies, ladies and gentlemen, it's an honor to speak to you today under the theme Health for All for Health. I want to express our deep appreciation and support for the WHO General Programme of Works 14. The principles and priorities outlined in the GP14 are crucial as we work towards the shared goal of ensuring health and well-being for all people. Qatar, under the wise leadership of His Highness Sheikh Tamim bin Hamad Al Thani, Emir of the State of Qatar, and guided by the Qatar National Vision 2030, has continued to strengthen its robust healthcare system centered around comprehensive universal health coverage for all members of society. To this end, we are proud to announce that we shall be shortly launching our Qatar National Health Strategy 2023-2030 to support the realization of the Qatar Third National Development Strategy 2023-2030, and in alignment with the WHO GP 13 and 14. Qatar is proud of the support and co-sponsorship from several countries for our proposed resolution on strengthening health and well-being through sports events. This initiative, which builds on our successful experience hosting the FIFA World Cup 2022, promotes an innovative whole-of-government, whole-of-society approach to protect and enhance health. We're also pleased to continue our contribution to the International Public Health Dialogue at the World Innovation Summit for Health, WISH 2023, to be held on the 13th and 14th November. Your Excellencies, the State of Qatar highly considers the international cooperation and solidarity in helping countries, people, and communities suffering from humanitarian crises. Our country provides development assistance to countries in need and to international organizations, as our contributions include supporting sustainable development projects such as health and education projects. We live in difficult times, and we cannot overlook the severe impact of conflicts on health. The protection of healthcare infrastructure and personnel must be a priority everywhere. Together, through solidarity and shared vision, we can overcome the challenges we face and build a healthier future for all. Thank you very much.
Thank you. Ecuador, you have the floor to be followed by Israel.
Señor Presidente.
President, at this assembly, we'll be dealing with issues that could redefine the future of multilateralism and global health. We are facing a major challenge, but also a historic opportunity to improve international cooperation, particularly through the launch of the WHO investment round, and to consolidate health at the global level. Universal health coverage and access to healthcare are essential to achieve the 2030 SDGs. However, there are gaps in coverage, quality and access, particularly for the most vulnerable. Ecuador is fully committed to strengthening our healthcare system in order to try to achieve these objectives. And we have shown this commitment at the multilateral level. We would like to see a change in healthcare systems to benefit the most vulnerable. Allow me to deal with 6 main issues that are fundamental for our country, Mr. President. The Treaty on Pandemic Prevention, Preparedness and Response is the key issue on our agenda, and the world expects. The COVID pandemic demonstrated inequalities between countries, some who produce medicines and others who don't, and had totally different consequences on health for developed and developing countries. Progress towards UHC has now stagnated following the COVID pandemic. Out-of-pocket and catastrophic health spending has also increased, as well as extreme and relative poverty. Gaps in universal health coverage are directly linked to inequality. The systematic use of macroeconomic indexes, such as the GDP or the level of income, high or medium income, means the countries are categorized, and that can impact the priority with which they receive support from international bodies, technical partners, and indeed investment for development and other global health actors. Investing in fighting neglected tropical diseases has also been a priority for Amazon countries, and we need further efforts to ensure investment in these neglected tropical diseases, which are treatable and controllable. We are following closely the discussion on the prevention and control of NCDs and the Immunization 2030 agenda, and putting an end to TB and antimicrobial resistance. Health and climate change are situations that require cross-cutting measures, and we stress a health approach in all policies that have direct or indirect effects related to climate change. Thank you, Chair.
Thank you. Israel, we have the floor to be followed by Slovenia.
Thank you. On October 7th, a war was forced upon us when Hamas terrorists infiltrated Israel, carrying out horrific massacre. Thousands of rockets have targeted Israel from several fronts. Our hearts are with the many, many hostages held in Gaza and the hundreds of thousands of displaced Israelis. Israel treated over 15,000 casualties from that day, many with long-term care needs. We have prepared our hospital for casualties, protected patients from missile attacks, reduced hospitalization, transfer wards underground, and opened new wards in converted parking garages. We identified and buried over 1,200 murdered victims at the same day. I took part in the effort, and I will never be the same. The Israeli people will bear the mental scars of October 7 for generations to come. Amidst these horrors, Israel had employed a model of building resilience, combining therapeutic community work and emergency preparedness to deal with collective post-trauma. Israel will continue to expand the system. Israel medical teams consist of Muslims, Jews, Christians, and others working together to save lives. This sacred duty, our answer to the incomprehensible depravity we witnessed. Mr. President, Israel is in a war with Hamas. We do care deeply about suffering of the civilians in Gaza and work tirelessly to facilitate the delivery of medical care and humanitarian aid to these in need. This civilian suffering is first and foremost the result of Hamas' brutal leadership and the systemic use of civilian population and civilian infrastructure, including hospitals, for military purposes. We would like to thank WHO European region for their support, certainly for Dr. Hans Kluge and his team, and the supporting of our mental health program for first responders. Mr. President, Israel attaches great importance to the inclusive participation in the WHO Assembly for the benefit of the global health and hope to find a way to enable it to happen. Regarding IHR and our pandemic instrument, Israel believes that these tools can improve cooperation, coordination and solidarity. We must learn from the last pandemic, focusing on preparedness and prevention while respecting state sovereignty. We must understand that the challenge, including intellectual property, property rights and innovation, we should and have to overburden the member states but establish a realistic and efficient financial support system. We look forward to continue this important cooperation with all stakeholders. We would like also to offer our heartfelt condolences to Papua New Guinea for the horrific tragedy they have suffered last week. Thank you. Bye-bye. Thank you, dear President.
Thank you. Slovenia, to be followed by Republic of Korea.
Honorable Chair, Dr. Tedros, distinguished delegates, Slovenia aligns itself with the EU statement. I am honored to address the 77th World Health Assembly at this critical period. The COVID-19 pandemic underscored the fragility of our health systems and the need for a decisive global response based on equity and solidarity. We must leverage this experience to build resilient health systems in our states and strengthen the global health architecture. Important progress was made in negotiating IHR amendments and pandemic agreement. Slovenia remains committed to engage so that both processes result in all of us being better protected. Climate change remains an existential threat to global health. Last year, my country experienced the worst natural disaster with devastating floods. This was one of many reminders that we can no longer delay concrete action, and I, as a Minister of Health, decided to contribute by decreasing carbon footprint of health system in my country. I count on the guidance of the WHO. We can also not postpone decisions in addressing the devastating health impacts of ongoing conflicts. Slovenia stands strong in condemning any aggression that is resulting in immense suffering of civilians, loss of life, and a severe humanitarian crisis. The deliberate targeting of civilians, attacks on health infrastructure, and violation of international law in this regard should be stopped immediately. Destruction of health system and blocking humanitarian aid has the most devastating effects on the vulnerable women and children, as we are witnessing in unprecedented levels in Gaza. Slovenia commands WHO to tirelessly provide support to affected populations, and you, Dr. Tedros, to speak up against such international law violations. We also thank WHO Euro and Dr. Kluge for mobilizing us to support the rebuilding and strengthening of Ukrainian healthcare system. The theme this year is All for Health, Health for All. Slovenia understands this literally and advocates for social participation to become an integral part of our efforts to ensure health for everyone. Based on our experiences, we know that engaging communities and civil society in health policy cycle fosters trust, enhances compliance with proposed measures, and empowers communities and individuals to take ownership of their own health. Together with Thailand and supported by many, we have tabled a resolution on social participation. The aim is to innovate and exchange good practices in social participation, and as a result proceed faster with achieving UHC goals. I count on your support. Thank you.
Thank you. Republic of Korea to be followed by Uzbekistan.
Honorable President, Director General of WHO, Honorable Ministers, ladies and gentlemen, the Republic of Korea strongly supports this year's theme, All for Health, Health for All, recognizing that it captures all the tools necessary for achieving a better health. In particular, the success of the 14th General Program of work requires the active support and participation of all member states. I do hope that with all our support, GPW14 will successfully contribute to the attainment of the SDGs. As WHO has been leading the global approach to ensure the highest possible level of health for all, the ROK has also continued to provide its contribution to provide health for all at the national and international level. Domestically, we have seen needs for healthcare reform to address various emerging issues such as demographic challenges due to declining birth rates and aging population, rising healthcare demand, and disparity in the healthcare workforce distribution. Accordingly, the ROK is moving forward with a healthcare reform package to ensure that our people continue to enjoy a healthy life for years to come. Internationally, the ROK will continue to cooperate with the international health community, including WHO. We will continue supporting capacity building for developing countries through the Global Training Hub for Biomanufacturing. In November, we will host the 3rd World Bio Summit, once again bring global leaders together to discuss current healthcare issues. As WHO strives to further its work in other regions in the coming years, the ROK remains committed to its cause and calls on all member states to join in and provide the necessary support. Thank you.
Thank you. Uzbekistan to be followed by Fiji.
Ассаламу алейкум. Здравствуйте, уважаемый господин председатель.
Distinguished President, Director General, ladies and gentlemen, it is a great honor for me to speak from this tribune on behalf of the delegation of Uzbekistan and to welcome all participants to this important event. The topic is health for all and all for health. And this reflects what Uzbekistan is doing. In recent years, under the initiative of the President of Uzbekistan, we are achieving significant progress in improving our health care. We have introduced a broad range of reforms, including with regard to universal health coverage, and we are building new medical establishments and developing public and private partnership and ensuring access to medicines and also improving medical education and training of staff. We have created an entirely new system for providing high-tech technological specialized medical care. In the context of universal health coverage, we have totally changed the primary healthcare system on the basis of our new approaches, and this process is continuing. At the for the time being, we have assistance. We have for 37 million people in our country. We have 17,500 medical brigades which carry out checkups, and in this way, medicine is being brought to the population for preventive measures and to ensure the timely identification of diseases. Doctors who carry out their work in the most remote regions of our country receive additional salaries, and and together with local municipalities, they receive housing with a view to ensuring the early identification of non-infectious diseases and their risk factors. We are implementing screening programs for those with cardiological diseases and diabetes, particularly for those aged 40 and over, and also screening for breast cancer and cervical cancer for women over the age of 35. Last year, we adopted a strategy, and the main goal of this is to improve the life expectancy of those in our country. We're also looking to reduce rates of cancer and also maternal and infant mortality. We have developed a program to develop healthcare up to the year 2030. And in Tashkent, we are planning to hold a regional high-level meeting to achieve our goals through regional dialogue and in the region of Central Asia. And I invite all of you to participate in this. Thank you once again for your attention.
Thank you. Fiji, you have the floor, to be followed by Tunisia.
The President of the Assembly, Director General, Excellencies, I wish to commend the WHO on this year's theme, All for Health, Health for All, an inspired choice rooted in the right to health principle of the WHO Constitution. Mr. President, as individuals, we do not truly understand the value of health until it is lost. As member states, we did not truly understand the value of health until our lives were upended by the COVID-19 pandemic. We were reminded that true to the WHO Constitution, the health of all peoples is fundamental to the attainment of peace and security and is dependent upon the fullest cooperation of individuals and states. This insight drove us all to strive to do better the next time. With that goal, we, the member states of the WHO, decided to begin negotiations on a pandemic agreement and amendments to the international health regulations. Right now, we are not where we wanted to be when this process began over 2 years ago. We have moved on with life after COVID, and the world is forgetting the lessons of the pandemic, returning to business as usual. But another pandemic is a certainty, and we must continue the work we started to produce a pandemic agreement and amendments to the IHR centered on global solidarity and equity, with respecting national sovereignty for a world that is better prepared. Mr. President, Fiji faces a triple threat of infectious disease, non-communicable disease, and the effects of climate change. Fiji has alarmingly high rates of diabetes, cardiovascular disease, and kidney disease. NCDs contribute to 85% of all deaths and debilitate Fijians in our most productive age groups. Fiji attended the SEEDS Ministerial in Barbados, and we committed to the 2023 Bridgetown Declaration, focusing on addressing NCDs and mental health in SEEDS. Mr. President, Fiji has a rapidly growing HIV epidemic with the second highest rate of new HIV cases in the Asia-Pacific region. In 2023, we saw 71% increase in new HIV cases recorded and a doubling of HIV-related deaths. With illicit drugs abuse as a rising factor, Fiji's response is evolving. Mr. President, climate change is another great threat to human health that requires global action. As I said, Fiji's health is affected by rising sea levels, adverse weather events, and changing patterns of climate-sensitive diseases. While health has had the less visibility in global climate change action, we are pleased to attend the inaugural Health Day at COP28, and we hope that health will become a permanent agenda item of the future COPs. Fiji is also pursuing a resolution on climate change and health, as well as strengthening health emergency preparedness for disasters resulting from natural hazards, and we will look forward to the support of member states. Mr. President, this Assembly will look forward to a spirit of global cooperation and solidarity for the protection of humanity for many generations to come. And I thank you, Mr. President.
Thank you, Tunisia, to be followed by Russian Federation.
God's greetings be upon you. Your Excellency, Dr. Ghebreyesus Decoloti, President of the World Health Assembly, Mr. Director General of the WHO, Your Excellencies, dear colleagues, ladies and gentlemen, I would like at the outset to congratulate you, Mr. President, for your election at the head of the 77th World Health Assembly. Wishing you all the success and as well for this annual event in service of the global health system and the international community's capacity in this regard. I would also like to renew our thanks and appreciation to Dr. Tedros, the Director General of the WHO, for the statement he made at the outset of this WHA, and which shows the size of challenges being faced by the international community, which can only be overcome through a comprehensive approach to the reform of the many sectors of the international health system and developing the health systems of all countries. Mr. President, the slogan for our meeting this year, Health for All and All for Health, reminds us of what was reaffirmed by the DG through the COVID-19 pandemic, that none of us is safe unless everyone is safe. The call of our President of the Republic, Mr. Qais Said, on the 30th of March 2021, alongside 25 of his counterparts in this regard, has gone in this direction, calling for a renewed impetus for international treaty to protect from pandemics and to be better prepared and to provide prevention. And in this regard, and despite all the good intentions, we were not able to achieve agreement in this regard. Tunisia also would like to record its satisfaction with the progress made by these negotiations and aiming at further progress in this regard. We have all worked collectively to provide healthcare to all without distinction, and this calls on all the concerned parties to contribute. In this regard, Tunisia, alongside 14 member states, is submitting a draft resolution with regard to institutionalizing social participation for health and well-being, and based on the Tunisian expertise in this regard. Mr. President, I would conclude by mentioning the gravity of situations of healthcare in Palestine, which requires of the international community and our organization specifically to intervene quickly to save the Palestinian people who are being targeted by an unprecedented vicious campaign by the occupation army, and to provide the necessary healthcare and treatments to the sick and the wounded, especially in the Gaza Strip, while reminding the importance of channeling humanitarian aid and lifting the blockade. Thank you for your attention.
Thank you. Russian Federation to be followed by Morocco.
Уважаемый председатель,
Distinguished President, colleagues, modern healthcare challenges demand from us consistent, well-calibrated and coordinated work both at an international and regional level as well as at a country level to ensure the achievement of the Sustainable Development Goals. The philosophy All for Health and Health for All, which has become the main topic of this session, fully reflects Russian national priorities. Protecting the population and improving health in our countries are set as our national goals by decree of the President of the Russian Federation. We are conducting consistent work to achieve these goals. The implementation of our national health project, which provides for a set of scientifically based interventions in the field of oncology, cardiological diseases, diabetes, has enabled us to achieve an increase in life expectancy to the highest level in our country's history, that is to say 73.4 years, and also to reduce to the lowest level in our country's history the general mortality rate. Implementing public health measures has enabled us to reduce alcohol consumption from 18 litres per person to nearly 8 litres, and also to reduce smoking from 39.1% to 18.7%. 2024 has been declared by the President of the Russian Federation as the Year of the Family. Protecting maternal and child health and reproductive health remain our unconditional priorities. The adopted measures have enabled us to reduce to minimal levels infant and maternal mortality. Nearly 100% of those born in Russia are covered by neonatal screening for more than 40 congenital and hereditary diseases, which enables us to provide necessary healthcare where necessary. More than 95% of children go through yearly preventive medical checkups. More than 98% of children are covered by vaccinations in line with our national immunization calendar. We are implementing a project to protect reproductive health, through which we have a number of measures, and we have some international projects for which we work with foreign countries on treating infectious and non-infectious diseases. We would also like to support delegations that have spoken about how unacceptable it is to apply unilateral coercive measures when it comes to medical equipment and medicines, which undoubtedly has an impact on health. The Russian Federation will continue to undertake all necessary measures to improve health at a national and at an international level. Thank you for your attention.
Thank you. Morocco, you have the floor, to be followed by Zambia.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين معالي السيد رئيس الدورة السابعة أصحاب المعالي السيد
President, Excellencies, ladies and gentlemen, may God's blessings be upon you. I would like to use this opportunity to express the gratitude of the Kingdom of Morocco to the WHO for everything that has been achieved over the past year, given the increasing number of emergencies across the world. We would also like to thank the WHO for its leading role that it plays in order to strengthen health across the world, and we are delighted to participate with you in this session of the WHO with the topic All for Health and Health for All. Only collective efforts will enable us to face these global challenges. Ladies and gentlemen, today we are living in an extremely difficult global context. Therefore, all of these crises, and it is time to invest in national and regional policies which will enable us to respond to these crises. South, and to strengthen collaboration with neighbouring countries and across the entire African continent. We are here to reaffirm the need to manage health crises effectively, which know no borders. The COVID-19 pandemic demonstrated this. Morocco remains committed to its efforts, whether it be within the working group of amendments to the IHR or within the INB, which is responsible for achieving a pandemic agreement. We would call upon the international community today to bring an end to the terrible crisis that is taking place in Palestine. We ask the international community to protect civilians. This is an initiative that has already been undertaken by the Kingdom of Morocco. Morocco is undertaking all necessary efforts so that no one is left behind. Today, we would like to call on all stakeholders to also work to achieve the migration pact. There was a high-level meeting that took place in Morocco on this topic. Today, Morocco is working to achieve health security again upon the initiative of His Majesty the King. We appreciate in this regard all of the expertise, and we would like to gather experts within a multidisciplinary context, and the Kingdom of Morocco has also organized a meeting on road security, and in September we are going to convene a commission that will be responsible for studying social determinants in this regard. We are sure that the resolution of this assembly will have a positive impact on health across the world. Thank you.
To be followed by Bangladesh.
Mr. President, it is an honor for me to speak on behalf of my country, Zambia. Zambia aligns itself with the statement delivered by Botswana on behalf of
เอพิโซดนี้ของคำนี้ดีกลับมาอีกครั้งกับฟังแล้วพูดตามนะครับเป็นพาร์ทที่ 6 แล้วง่ายๆเลยเข้าไปที่ YouTube นะครับเสิร์ชฟังแล้วพูดตามคำนี้ดีถ้าเกิดชอบคอนเทนต์แบบนี้ในการฝึกฟังนะครับแล้วก็พูดตามออกเสียงกันไปแบบง่ายๆนะครับน่าจะเป็นประโยคที่ได้ใช้กันบ่อยๆเลยทีเดียวนะครับวันนี้เป็นเรื่องของการฟังแล้วพูดตามเวอร์ชั่นภาษาอังกฤษแบบซ้อมคุยกับแฟนเป็นศัพท์สำนวนประโยคที่น่าจะเอาไว้ได้คุยกับแฟนมากเป็นพิเศษแต่ผมว่านะหลายๆประโยคเนี่ยก็สามารถพูดกับคนอื่นได้ด้วยนะครับก็ลองฟังแล้วก็พูดตามกันไปง่ายๆแค่นี้เองพร้อมแล้วเริ่มเลยครับนี่บอกหน่อยดีเธอชอบคนแบบไหนเหรอ So tell me what's your type So tell me